because everything is so genetically engineered. When you look, we brought up even peanut butter on this show. Pull your can of peanut butter out of your cabinet and look at what's in that. If it says anything other than peanuts, you're putting processed food in your body. You're putting preservatives in there. And people don't even realize it. They think that they're eating something that's nutritionally beneficial because they're searching out for these foods that may contain the minerals that they've heard that cure foggy memory, cure insomnia. But that's really not, the point out there. And, it drives me crazy, like we had talked about when we, see these vitamin shots, and we really think that the listener should be educated on what they're getting and make sure that they're getting the active form if they really do need that. And not all B12 is great for you. Yeah. And some of them supplements even, we had people read last week on the other ingredients. You'll see it way down in a font of 4 where you need a magnifying glass to read it. And I've had people this week even bring into the clinic, their vitamin supplements and what they're taking. And then I pull it out to them. We talked about this big crave out there for, losing weight, the HCG drops. And I've had somebody bring in that actually had ethanol alcohol in it.
Wow.
In the HCG drops. And how great can that be for your body? A good example is people that have high cholesterol. They go on a statin drug, and it causes all these nutrient deficiencies that actually may be giving them joint pain, muscle pain. And I hear it so often that people say they're allergic to something because they're having side effects. But ultimately, it may be just blocking all the nutrients in your body that cascades to all these other symptoms and problems that oftentimes you get put on another medication to help cure that symptom and problem.
What's that called? That's called iatrogenic. Isn't that called the iatrogenic effects of medicine? That, you've got something that then dovetails and you've got to take Haldol, you've got to take, a Tagamet or something like that to counteract the negative effects of the med that you're on. Right?
Exactly. And oftentimes, my patients will come in and they may be experiencing fatigue and you pick up that they're on this statin drug and has anybody ever told you need to take a good quality CoQ10 because that drug actually blocks your CoQ10? And we all know the importance of CoQ10. I mean, you can do a simple Google search right there on that and see how it affects your heart and how it affects muscles and joints. And oftentimes people will come in and they've had these leg pains and joint pains and taking a simple nutrient and we'll test them and they come back deficient, fix their nutrient deficiencies, and they feel fantastic.
And CoQ10 is a part of energy producing that's called the electron transport chain. And so that happens, within the myalgias when you've got the fatigue and the pain, and there's all sorts of different kinds of fatigue. I'm sure you see this all the time. People are like, I'm tired. You say, well, do you not sleep well? Well, no. Okay, that might be one reason you're tired. But I'm just tired. Like I can't think anymore. So mental fatigue. That's a different kind of fatigue. They're all related to various nutritional inadequacies or sub-optimizations. And so if, you are not optimized in terms of what is right for you, then you're going to have all sorts of exacerbations of symptoms that become sort of unspeakable. You go to your standard doctor and you go, I'm tired. And they go, great, take this Ambien. This is going to help you sleep better at night. But that causes a whole slew of other nutrient deficiencies. Your B vitamins, your calcium, which is supposed to be helpful for relaxation and sleep. So you're dumping your calcium, magnesium, which is also great for cardioprotectiveness as well as muscle relaxing.
One of the most common deficiencies,
exactly,
magnesium.
You see that a lot, don't you? Magnesium is a huge thing, especially with people who oversupplement calcium. So we know that in America, calcium is supposed to be great for bones, but then we overdo it. Let's see where you are, get a baseline of where you are, and find out what you really need so that you can create a plan with Dr. Thomas that she can track and make sure you're actually achieving eradication of those symptoms that are esoteric. They're benign symptoms that you could just limp along for a long time until you realize you've got diabetes or you've got, whatever degenerative cardiovascular disease that you have. If you're at the pinnacle or at the top of that hill, the hill of health, we call it, which is, I know, a little cheesy, but it makes a good point, that there's a slippery slope. By the time you're checking your blood pressure and looking at even particle number above and beyond what we're looking at with cholesterol, if you're already down there because your BP, your blood pressure is rising, you've already slipped halfway down that health slope, that hill of health. We want to check, you want to check yourself when you're not that far down the hill before you have prediabetes or overt diabetes. So why wouldn't you check that genetic structure? Why wouldn't you look at the micronutrient analysis and see where you are to see how you can really prevent? And it's a truly preventative test, which I think is what makes it unique.